This is Sean with Safina Psychiatry. Today we'll be talking about the origins of the collaborative care model. It all began with a psychiatrist named Wayne Katon at the University of Washington. Dr. Katon developed collaborative care because the University of Washington was charged as the primary healthcare provider for 5 states that did not have enough psychiatrists to meet the needs of those with mental health conditions. He started by studying the presentation and prevalence of medically unexplained symptoms in depression in primary care settings. Early studies identified depression care gaps in primary care. Additionally, letting primary care providers simply know about a patient's depression diagnosis or being provided decision support were insufficient to improve outcomes. This led him to study the collaborative care model, which was largely based on the chronic illness care model developed by Ed Wagner. For more information on the collaborative care model, please check out the link in the description below. Dr. Katon showed that collaborative care was effective for the management of depression in primary care. Realizing that there was a bi-directional relationship between depression and diabetes, where one condition increased the risk for the other and worsened the overall prognosis, Dr. Katon pursued the Pathways study, which specifically examined the effectiveness of collaborative depression care for patients with both diabetes and depression. The idea was that a more activated patient with treated depression would be more likely to take his medications, eat better, get more physical activity, and in turn reduce his glucose levels. While the model successfully reduced depressive symptoms, it did not have a significant effect on glucose control. This finding prompted him to his next large randomized control study, the TeamCare study. This one expanded the focus to integrate the treatment of depression with other chronic medical conditions, monitoring a wider range of outcomes including blood pressure, lipids, glucose levels, and depressive symptoms. This version of collaborative care was found to be effective for multi-conditions. Other heavy-hitting health services researchers have made significant contributions to the field. One of the best known and largest collaborative care trials is the IMPACT study, led by Jürgen Unitzer, also at the University of Washington. This trial focused on elderly depressed individuals and demonstrated that a collaborative care approach led to sustained improvements in depression, reduced pain, improved physical functioning, and was cost-effective. Jesse Fan has been instrumental in adapting the model in oncology settings, while researchers like John Fortney, Joseph Saramelli, and Amy Bauer have expanded its use for complex psychiatric illnesses such as bipolar disorder. At the time of this recording, the collaborative care model is being studied and implemented across a vast array of medical settings for different populations and conditions worldwide. Thank you for watching. If you got value from this video, please like and subscribe.